Hi. Today we are going to learn about a procedure called as Express TKR, that is Express Total Knee Replacement. Let us see the knee joint. The knee joint is made by the thigh bone here, the leg bone or the tibia, and the patella, that is the kneecap. Uh, if we see inside the knee joint, then you see this cartilage which is smooth lining, and so the bones don't rub on each other. And this is a shock absorber like meniscus which is in between these two bones. Nowadays we see that the age limit or the life expectancy is on an increase and people live longer. Also obesity is increasing, there are a lot of hormonal problems, and the main issue is degeneration of the knee joint. So what is a degenerated knee joint or osteoarthritis? If you can compare the model with the earlier model, we can see that the cartilage inside the knee joint completely breaks down, and this exposes the underlying bone, and which is excruciatingly painful for the patient. The patient gets stiffness of the knee, the range of movement of the knee joint is reduced, the day-to-day activities of a person, they are restricted, and the person is dependent on other individual. So to take him out of this, total knee replacement is a procedure which has been in use for quite some time now. Knee replacement is one of the most successful procedures. But the problem is that it was too invasive sort of a procedure. The morbidity after knee surgery also was an issue. So we have come across a method in which this can be modified and the patient can be on his or her own, without much cutting of the normal tissues. Now earlier, when we used to do a knee replacement, there were a lot of bone which was cut. The ligaments, especially the backside ligament, that is the cruciate ligament, was cut, and so it was a morbid surgery. Also, it used to take a long time. Now we preserve all the normal structures in the knee by in this technique of Express TKR. We don't put rods in the knee joint, and so it is like a resurfacing procedure which gives a patient a quick relief, and the patient can actually walk the same day evening and can be discharged in 3 to 4 days after undergoing a bilateral total knee replacement. So let's see what is the technique. So these are again two bones. This is a sawbone model in which if during TKR, what we have to do is that this sort of bulky instruments have to be used, and we have to insert this big rod inside the bone. This is a traditional or a routine method of doing knee replacement. So this bone, we have to make a hole and then put this inside, and all this bulky assembly makes the life of the surgeon very difficult. And you can imagine that once this goes inside, how big sort of a invasion of the bone marrow will be there. So now in the new method, we don't cut the ligament, that is this posterior cruciate ligament. We don't cut the bone, we just remove this diseased or a damaged part of the cartilage and use what is called as this device, which is a handheld iPod like machine, which will be giving us actual idea of the precision of the angles of the knee joint. Everybody's knee is different in shape, size, the range of movement, angles, etc. So this ortho-align or knee-aligned system is used, which is based on gyroscopes and accelerometer, and it is attached to these bones, and this gives us complete precise reading of the angles of the knee joint, where it is damaged and how we have to correct it. So during surgery, I don't have to use all these bulky things which go inside the bone. We use all this sophisticated new technology which is used in aeronautical industry, in medicine practice, and which gives me a complete precision of half degree or 0.5 degree accuracy. So what happens is, here in this surgery, we don't cut the ligament, we don't cut the bone, and we just replace the cartilage. So it becomes a very, very tissue-friendly surgery, tissue-conserving surgery, bone and ligament conserving or preserving surgery. After this surgery, the patient walks immediately the next day or the same day also, and the patient can go home immediately after 2 to 3 days. The pain is controlled in this. We don't have to take out the kneecap also or the patella also, and we can just resurface that. So all this new technology, due to the fast sort of recovery of the patient, we have named it as an Express TKR, which technique has given I'm sure is going to give a huge relief to our suffering patients. Thank you.